Hi, I'm David Watson from Joint Ventures Physical Therapy, and we're here to talk about a couple of exercises that are great for correcting the rotary collapse. Rotary collapse, if you're not familiar, is something that happens during the stance phase of gait, where the hip moves into internal rotation, the knee moves into a valgus force, the ankle overpronates, and the trunk moves into a flexion, side bend rotation, creating impingement at the hip. And so this is our normal kind of mid-stance position with a lot of our injured athletes. So what we're going to do is modify the clamshell and the single leg step down in order to correct that rotary collapse. So we'll start with our traditional clam exercise. Get the band around the knees. We're going to add rotary stability by using the resistance bands. While we're in the clam setup, instead of being in a 45-degree bend, kind of targeting gluteus medius, we're going to try to target gluteus maximus by being in a neutral hip extension. We're going to drop down onto our side. First thing we're going to do is contract transverse abdominis and gluteus maximus, finding that neutral spine position. Then we're going to lift up into that hip external rotation. Then we're going to apply a trunk rotation as we move into that side bend and flexion and rotation of the trunk. We're still maintaining transverse abdominis and glute max. We're going to eccentrically return our trunk to a neutral position. Then we're going to lower our knee back down to rest, and then we can relax transverse abdominis and gluteus maximus. And then, if we transition that to a higher level exercise, we'll move into the step down. And you're going to use that same trunk rotation band. You're going to twist yourself into the band so that the band is immediately trying to pull me into a trunk rotation. And so I'm going to find an athletic position with my stance leg in front, and then I'm going to find a neutral ankle by rolling out but keeping my big toe on the ground. I'm still going to contract transverse abdominis and gluteus maximus, and then I'm going to try to remove my uninvolved foot from the ground and try to maintain that neutral position. So as I pick that foot up, the band is trying to pull me into that trunk rotation, and I'm trying to just stay neutral. If I can master this position, then I'll move down and actually add that single leg squat component. All right.